Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So I have two guests with me. I have Marissa, who is going to become a regular. She's just going to come on every day with me, and we're going to talk about beauty and aesthetics. And then Meredith is with me too. I'm going to let both of them, and Meredith has been on before. These two are the dream team. And we're going to talk about Tightsculpting, which is exactly what they do. They contour and reduce your fat and tighten your skin and make you look gorgeous. So I'm going to introduce them, or let them introduce themselves again, and then we're going to talk about Tightsculpting.
Hello, I'm Marissa. Welcome.
Hi, I'm Meredith. I'm a skin specialist at RevitalyzeMD, and we are going to talk about Tightsculpting today.
Perfect. So if you haven't heard about Tightsculpting, it is a treatment, and really just to make it simple, we're talking about body contouring, which is a hugely popular treatment, especially as we approach summer and bathing suit time, where we're going to kill fat and tighten skin and contour your body, essentially. So one of our machines is the Fotona machine, and it does this amazing treatment called Tightsculpting. You'll hear different terms and names for them all, but the bottom line is you want to do fat reduction and skin tightening at the same time. You do not want to do just fat reduction, because skin, fat, muscle maintains the tone of your skin, and you're going to have subcutaneous changes if you kill the fat, and now your skin is laxed. So if you guys want to talk about maybe the difference between just fat reduction, which would be cool sculpting, we've actually seen a couple even complications of that, right?
Yes, we have. The difference, I would say, with a cooling device that is going to freeze the fat is not going to have any impact on the skin. So you're going to have loose skin and less fat. And what's the point of that? You might as well have had plastic surgery if that's the case, a body lift. Point of the matter is nobody wants to go under the knife, and that's the reason body contouring is so popular. So a heated device is going to work better for the skin laxity and actually tighten the skin as well as kill fat. So it's something that works hand in hand together, and there's a method to the madness, and that's why we're here.
That's right. And so Tightsculpting, and I would even go further with liposuction, because even with liposuction, which again is, them going under the knife and surgically removing fat, but it gets lumpy and bumpy after, and you still need that smoothing and tightening out. And so these laser treatments are still needed, even if you have surgical liposuction. Yes. There are some devices that will do both, but again, it's a minimally invasive procedure, still really requiring a surgery, and not just these devices that don't have any opening in the skin, nothing that actually penetrates the skin. So Tightsculpting, again, body contouring is what we're going to call it, but it is one of our specific treatments that we love, and it is done with a huge beast of a machine, and it has a robotic arm. And so therefore, if you want to talk about exactly why you love Tightsculpting so much.
I love Tightsculpting by Fotona, because you get two lasers in one. So you do deep tissue heating with a 1064 nanometer, as well as what I call shrink wrapping for tightening the skin with a 2940 wavelength. So you're going deep, and then you're smoothing it out also from the exterior. And that's basically what it's doing.
It's great because there's no downtime with that, because with anything else that you do, any kind of procedure that you do in office, and obviously any time that you use a knife, and you're either trying to cool or freeze the fat, or you're trying to burn the fat or cut the fat out, there's going to be downtime. So with Tightsculpting, we can get in and out. We kind of section it off, and depending on how large the section is, the longer that the treatment takes. But typically, we're looking at 1 hour for most smaller sections, and then it can be up to 2 hours for our larger sections, but there's no downtime. You're going to be a little bit heated, obviously, because you're really trying to heat up all of that body fat underneath the surface, trying to reduce it. And then, like Marissa said, shrink wrap the skin on the outer side of that fatty layer to kind of bring it all in together. You're killing, you're tightening, you're shrinking all at the same time. Because again, anytime you try to kill body fat or burn it or freeze it, you're still going to have skin elasticity. And unless the skin is tightened around all of the body that you've tried to contour, then it's not going to be contoured because you're still going to have that skin elasticity. So that's the goal, to have very, very minimal downtime, which with tight sculpting, there is none. So a little bit of heat that you're going to feel sometimes for about an hour. Sometimes people feel it really for 3 or 4 hours, but just heat. It's not an uncomfortable heat or pain or anything like that. So that's the glory of it. You can leave the office and kind of go and do whatever you need to do, go shopping, go to baseball games, do whatever you need to do, and not have to work on healing things or still worry about the skin elasticity that you would have had if you would have gone in office and still done a non-invasive treatment like cool sculpting, and then still had the skin to deal with after it is said and done by getting like a mini tummy tuck or something like that. Once the fat is gone, you still have the skin. So then you're still under the knife.
Right. Which we have fixed a lot of situations where people have gone other places, like Dr. Durst mentioned, liposuction, loose fat from cool sculpting treatments and liposuction. And
cleaning up messes. Yeah. Right.
Mm-hmm. And that is a treatment that, because of the deep heating that you get from step 1 of the tight sculpting, it's going to help get rid of that faster. And the treatment is faster. You get faster results than most other devices out there.
So I think that when we start talking about body contouring, for simplicity, because there's lots of different names for body contouring, but if you just think you have some fat or cellulite or loose skin somewhere that needs to be treated, and again, let's be honest, like what woman doesn't have an area, even if it's a small area,
right?
It just, as we get older with perimenopause or menopause, we have more areas, but we all had them like, again, what is it called? Saddlebags, like behind the post, behind the legs, under the butt. That's a common area and younger, but then we get more areas as we get older. So, behind the arms is very common with women. The bra fat,
the front or the back of the bra fat.
Yes, correct. Because the small little areas, you're right, front or back, and you can treat small or large, but also abdominal. But again, that above the knees is and thighs are a huge thing with women with perimenopause and menopause. So it's body contouring. You always want to do fat reduction with skin tightening because, as Meredith talks about and Marissa, shrink wrapping, so that your skin is tight and keeping everything in, because again, that's what we're losing with time is our fat gets a little more lax. We get more of it. It gets inflamed. You get cellulite pockets. And so we want to kill and smooth that out, but shrink wrap the skin and tighten it. So if you're doing cool sculpting, and again, you have to kill the fat. So the heat kills the fat for sure. Again, cool sculpting does, but occasionally you get a rebound. Yes. Where you get more fat than you had before. So obviously those fat cells were not dead.
Normal fat.
Yeah. And that's actually, not a real common, but it is a well-known complication of cool sculpting that we have seen at least one patient and had to correct.
Yes.
So again, we have not had that issue, and you're not going to have that issue with devices that do fat reduction and skin tightening. So always want to do that. So again, cool sculpting, just fat. Kybella, just fat. Liposuction, just fat. So again, those are all treatments that you're really going to want to consider a non-surgical or a body contouring treatment. And again, I think tight sculpting is the best one that I have seen.
Yes.
Robotic arm can treat larger areas as fast as possible, because you're getting diffuse uniform heat, right?
Right.
And so you guys have seen big areas, and you guys are not big areas, meaning the person's big, but like a whole abdominal area is like a large, area.
It's right. And there you've got, you've all got different shapes and sizes, and everybody's some people have really short torsos, some people have really long torsos. So therein lies just really the difference. There's not a difference in the treatment or the amount of fat cells that were required to burn of any of that. It's just a little, the time management is just a little bit different, you know, and you can spend a little bit more time with more challenging areas within that same section that we're treating. So everybody really is a candidate for tight sculpting. And when you're any area of the body, it doesn't even really have to have, you don't really have to have an excessive amount of body fat in order to really make great changes. And we can always tighten skin without reducing body fat if it's mainly just a skin elasticity issue. We can smooth things out really well. If there's cellulite, they're not necessarily a huge amount of fat that comes into play with cellulite. It's the fibers just needing to be smoothed. And with that Fotona machine, we can smooth that out, totally kind of reform those fibers to make everything on the outside look a lot more smooth. Because I really don't know many people over the age of 40 that don't have tiny little pockets someplace on their body that if that was just smoother, like I don't really want to lose a bunch of weight. I don't, I go to the gym, I do all these things already. I eat well, I drink lots of water. Why is this, bundle, on the back of my leg or in the front or wherever? So it's really, really good for just heating up that tissue and trying to reform it and smooth it out. And that's where tight sculpting is really awesome.
So how comfortable? I mean, I've seen it and I know the answer to this because, very comfortable, right? Because heating, that's the other issue with body contouring devices is that you're going to have some discomfort. And I've sat through a couple, at least one in particular that I remember, and it gets very hot and it's very uncomfortable. And you got to get the fat to a certain temperature or you are not going to kill the fat cells. And with this, you use some other trick to keep it comfortable.
I use the Zimmer for step one. If they have a low pain tolerance, there is the Zimmer that's going to help cool the outer layer of skin off as I'm heating the deep tissue or the adipose tissue that is very deep. And then I have a tapping method that works if step two doesn't feel good, but it works and I make it very tolerable, and no one has not wanted to come back for their second treatment, third treatment, fourth treatment.
Or adding on different areas.
Adding on every area.
Yeah.
Mm-hmm. Yes, I have lots of patients that are doing half their body. So it's a great treatment.
I've done the treatment myself. Even Marissa's done it to me, and I didn't even use the Zimmer. We're both trying to come up with other types of like manipulation things that we can do to try to kind of disrupt the areas near the laser to kind of just distract. And it's very tolerable when you do that because you're kind of trying to just manipulate the closer regions to where the laser is currently treating. And it really does something mentally to try to just encourage people to get through it. So a lot of times, most of my patients don't even use the Zimmer.
Yeah,
Marissa's got more people that actually do need the Zimmer, which again, that's just kind of like a huge air conditioner that really cools the outside surface of the skin while still not affecting the heated area that's underneath the surface.
The men usually need the Zimmer.
Right.
Well, and so tight sculpting is in particular a very good treatment, and that's a name. The machine is awesome, and it's the Fotona. So you will not hear it everywhere because that machine is very hard to use. These two are awesome about using it. It has about 180 different things you can treat. And you have to dial in, there's 2 wavelengths and you have to dial in and out those wavelengths to treat different things. And, so it takes a lot of skill to be able to use this machine. And again, these two are awesome at it.
She's a beast.
And so you won't always see it, but and again, this one is a robotic arm. And you can dial it in to do the fat. You can do just the skin tightening. And what's amazing about this is you can do only skin tightening if you wanted to. So in the areas of the neck, for instance, where we have crepey skin and we want to get rid of it, we can actually do skin tightening. You don't have a lot of fat in the neck. You do underneath the chin, with the double chin, but not in the neck and the décolleté. So those are areas that you wouldn't want to ever kill fat. So the other ones are not even an option. So they can't even do it, but we can skin tighten alone, and we can use other modalities with it, threads, maybe a little hyperdilate radius. So we can do some other stuff to help tighten and make that skin healthier as well. But that's the real, I think advantage is not only is it a little faster because it's a robotic arm, you guys know how to use that machine like not many other offices, in that you can actually just skin tighten too with it.
Because that's the case too, with a lot of women, especially older women. Most of your women that are over, say, the age of 60, that we talked about the knee skin elasticity. Most women don't have a whole lot of muscle mass in that area anymore because, things kind of start to disintegrate as we get a little bit older. So mainly as that muscle tissue starts to get a little bit smaller and we lose a little bit of activity, and they're not typically lifting a whole lot of heavy weights, or doing a lot of walking, doing a little bit more cardio, that skin just starts to kind of shift down closer and closer to the knees. And that's where it's great to be able to really focus on that skin tightening in that area, because it kind of lifts and smooths because you don't have the fat that you're really trying to cater to. So that's one of the most popular areas, is right around the knee and above the knee. And then again, the chest and neck are really important for that kind of over 50 to 60 age range too, for the women that are just kind of learning to cope with the changes in their body composition. And
they don't want to wear shorts anymore because now all of a sudden they have skin that's sagging. But again, a lot of those women are not overweight and have been active, and they're noticing changes, that they are doing the same things, eating the same stuff, but the changes are happening as we age. Well, we will say that we are able to get a little more comprehensive with those women as well, to get even better results, because we can hormonally optimize them, get them on some peptides. So they're building muscle again, they're energetic, their growth hormone is optimized with, both hormone optimization and some peptides. So body composition changes happen, but those aren't going to tighten skin. And so they still need that skin tightening, and love the results of that along with everything else. But it's a hugely popular area.
They can be 120 pounds and 20% body fat, and you're still going to have skin elasticity issues. So we're trying to,
and you can cover double the area as a lot of other with the tight sculpting treatment. You can cover a larger area than you can with a lot of other treatments out there in the same amount of time, according to what you're trying to accomplish. But yes, I like it much better.
Being able to adjust those,
result.
We're able to adjust the spot size, which is a huge perk, that most things are not that highly adjustable. So it's a really cool machine.
Use the robotic arm. It does it for you. You're going to get uniform results, all of that. And so, it's awesome. We do have another body contouring device. Again, it's awesome. We cannot do just skin tightening with it. So again, most body contouring devices, you cannot just do skin tightening. You can do skin resurfacing and still get some tightening, but not too many that actually have the robotic arm that you can actually do skin tightening, fat reduction, or just skin tightening. And this one you can. Our other device you cannot. And it's a little more time consuming from a provider standpoint and a patient standpoint, but an awesome treatment and not as and not as costly as tight sculpting. So again, a great almost monthly kind of thing to do for an area. They love an area, then they can go to another area, not quite as pricey, and definitely an area that wants fat reduction and skin tightening. So it's not as if you can't, I just think it's not as if you can't get other, treatments done. And we even have that in our office, but this is the best that I've seen. So
it heats so much deeper. It gets rid of more fat than any other device I've seen out there.
And actually our machine is very busy with tight sculpting in 4Ds. And so of the 180 other treatments, that's what we do.
Those
most
are definitely
of it.
I would say
the
sillier summer with shrink wrapping,
Yeah.
tightening, getting fat reduction with tight sculpting.
And so again, as we hit perimenopause and menopause, just for me, I have not been under that machine, but again, even hormone optimization and peptides and all that work very well. And the other one I have, but again, those same areas, like behind the arms, the bra fat, both areas, you're right. And that thigh and above the knee is huge for women as we get older and our hormones drop. And so doing it all and keeping it comprehensively is the best way to approach it and get the best results from the tight sculpting as well. So, the only thing else I would add is, even if it's not, and I think we might have mentioned this at the beginning, even if it's not a device killing fat and it's a surgery and liposuction, Kybella is another one where we've seen at least one where Kybella double chin, it kills the fat, but then you're stuck with skin that's left
that's with
loose.
Something that you still have to repair.
And so the thing is, you want to tighten the skin before you ever kill the fat. Mm-hmm. So if you're not tightening the skin first, then you're just going to have saggier skin when you kill the fat. Right.
You can't actually contour your body. Your skin is what contours your body. So you have to cater to what's under the skin, and to be able to conform everything and make it more contoured looking. That's where that toned physique comes in, that everybody's kind of, before as beach season kind of approaches, everybody's like, I really just want a six pack, and I really want my legs to have that nice shape. And well, you can kill all the fat that you want to, but if your skin is still kind of hanging over top of that fat, then there's not much tone that you're going to acquire if you don't really cater to both.
So I love the shrink wrapping idea.
Yeah.
And again, you have skin, fat, and muscle. So, again, if you're building muscle and you're young, if you lose that ability as you're old, there's ways to, again, comprehensively address that. But then you have the fat that's the structure in the skin. And if you lose one of those, yes, you're definitely, you are not going to contour. You can't shrink wrap with just fat reduction. So I love the shrink wrap idea.
Yeah.
I mean, think of all those people that get body wraps at spas. This is,
I always try to tell people,
laser body wrap.
Yeah, as far as muscle building and repair and all those things go, if you're not trying to get bulky or build a whole lot of muscle, if you're not working towards building, you're losing. It doesn't mean just because you're weightlifting and doing all those things, it doesn't mean that you're going to get bulky. Obviously, that requires hormones, and we can help kind of contour that as, you need to on a personal level. But if you're not working towards it, you're losing it. So we need to do all of those things comprehensively, which we can handle. Yeah,
all the things.
We can handle all those things in office. And then kind of that final result is shrink wrapping everything up and building that perfect package.
And getting you in your bathing suit for the summer, right? Shrink wrapping for the bathing suit. So absolutely. Bikini, all of that. So and it's actually right now, it just happens to be spring here and summer's approaching. And both of those, you need a bathing suit and you want to look good. So now is the time to do it. And it lasts. So it's not like it lasts just to summer. It's going to last for a lot longer. So anyhow, if you have any questions, comments, please leave them in the section and we will get back to you and respond as quickly as we can. And then again, like and subscribe, share with friends. That helps us get the information out there. If you have any experiences you want to share with some body contouring, Kybella, cool sculpting, anything that you've had done and you want to share those experiences, please do. And again, we're here to revitalize your look, your health, and your sex life.